On the same topic of cells, we're going to move into epithelial cells. And just a little bit of a reminder, epithelial cells are lining cells. They line all sorts of parts of your body. I mean, your skin is epithelial, squamous epithelial. And what we're going to see here is there are different epithelial cells in different points of the urinary system, and we'll talk about this in lecture. But some of them are totally a-okay to find in a urine specimen, and others are not. And so just pay attention to the normals and the abnormals here. They can get a little tricky to differentiate a couple of them, so do your best as we go through this. So we're going to start with squamous epithelial cells, or squamous epithelial cells, depends on how you say it. This one, I would say probably every single one of you will find squamous cells in your sample, particularly women. They tend to slough off more squamous cells into the urine, and they're totally normal. It's normal to find them. They are flat. You can kind of see that they're flat. They're pretty large. These will be the biggest things that you're going to see. If you stain them, the nucleus will stain a nice dark blue. They do have a pretty prominent nucleus. You can see here, this is a white blood cell. And their shape is sort of irregular. You know, they look like pancakes or eggs. They sort of look like fried eggs, you know. They never have one shape. They just sort of take all sorts of shapes. And they come from the urethra. So again, it's really not, it doesn't mean anything if you find them. It's just really normal. One of the things to look out for, though, is because they're so flat, they can fold up on themselves and resemble a cast, which we'll see in a little bit. So just take a note, you know, if you're looking at something, you're not really sure what it is, you think it's a cast, just keep in the back of your head, maybe this is one of those epithelial cells that has sort of folded upon itself. Sometimes, the only time when you really need to pay attention to these is when they are not contaminated but coated with Gardnerella bacteria. That's a particular bacteria that causes infections, and they tend to live within these cells, and when they are like that, they're called clue cells. And so it's not likely that you will see it, at least here, but there is a time when you need to say, that epithelial cell looks a little funny, let me investigate it a little bit more. So very common, you will see it, guaranteed. Transitional epithelial cells are also lining cells, but they come from a different part of the urinary system. Often they will be lining the bladder, the ureters, and the renal pelvis. And the name transitional kind of means changing, and part of the reason they got that name is because they change shape relatively easily. And if you think about what they're lining, you know, the bladder is contracting, squeezing, and expanding, and so whatever's lining it needs to be flexible. So these tend to have kind of funny shapes. A lot of times they look like you see here, very rounded and bubbly is the best way to describe it. And part of that is because they absorb a lot of water, and when they're full of water, they're going to expand. So it is not uncommon to see them looking like big bubbles. You know, if you blew some bubbles and they stuck together, that's what you'd see here. Their nucleus is usually in the center, and that is something you can do to help identify, you can use to help identify these cells from the next cell. Generally, they're in the center. Obviously, it's not always the case, but it's something to look for. They are normal. Just a couple of them are normal. If you were to see a lot of them, it might be the result of having a catheter, because that tends to cause them to clump, and that's okay as well. But if you saw a lot of them and their shape was a little bit off, they looked a little bit funny, that could be a sign of malignancy or perhaps a viral infection, and that would be something you would want to investigate further. You'd probably send to the pathologist to have a look at. So seeing some of these in their normal state is totally fine, but if you see a lot of them and they're abnormal, then you need to take a closer look. So those are the transitional epithelial cells. Now, the most clinically significant epithelial cells are the renal tubular epithelial cells, and these are the cells that coat the renal tubules. So, you know, your distal tubule and your proximal tubule and all those little things in the nephron. And so seeing any of these means something. They really should never be lost. And if you do see them, it generally means you have some sort of pathologic condition going on. You have some sort of issue within the kidney that's causing these cells to die and to be lost. So it's very important that you recognize these cells. They do have a wide range of shapes, as you can see. Sometimes they're columnar, sometimes they're circular, sometimes they're irregular. Here's a little funnier. These are a little bit more circular. And as I said, with the previous slide, you can look at the nucleus to identify them. Generally, their nucleus is off-center a bit. So you can hopefully see it clear enough to go, okay, it's probably a renal tubular cell. This is a hard one to identify. Again, most likely you will not see it in your specimen, but if there is an issue going on in a patient, it's possible to see that. They are absorptive cells, and oftentimes they absorb fat globules. If you were to see a renal tubular cell with fat globules in it, it would look like this upon normal bright field microscopy. But if you put it under polarizing light, you will see what's known as the Maltese cross formation. You can kind of see these little crosses here. And that is a sign of fat. Under polarized light, fat makes that sort of shape. And so these are called oval fat bodies at this point when you have these renal tubular cells that are full of fat globules. And that is important. Could potentially mean there's lipiduria, lipid being excreted in the urine, which is not normal, and something that would need to be reported. Oftentimes they can be stained sort of yellow if there's really maybe a hepatic issue going on. If there's a lot of bilirubin in the urine, since these are, again, absorptive cells, they'll absorb the bilirubin and have a yellowish color. So something to look for color-wise that might help you figure out what you're looking at. And these are the last type of epithelial cell we're going to talk about. Those are the three that potentially you could see. So we're going to move into casts next.